A little bit about child sexual abuse by Dr. Michelle Stevens. Child sexual abuse describes any sexual behavior between an adult and someone under the age of 18. It can also describe sexual behavior between two underage people if there is a significant age difference between them or they are developmentally mismatched. While child sexual abuse includes obvious behaviors like touching and penetration, it also includes less obvious behaviors such as looking at or showing body parts in a sexual manner, sharing pornography, or talking inappropriately about sex. Unfortunately, child sexual abuse is incredibly common. Up to 40% of all women and 13% of all men report that they experienced at least one episode of sexual abuse in childhood. There's a general belief that most child molesters are strangers that take children by force, but this is not true. In actuality, 90% of all sexual abuse is committed by someone the child already knows, either by family members such as fathers, stepfathers, and uncles, or by acquaintances such as teachers, coaches, neighbors, and clergymen. The vast majority of child molesters are heterosexual men. Child sexual abuse can have long-term consequences for victims. Adults who were abused as children are at increased risk for future sexual assaults, depression, anxiety, post-traumatic stress disorder, substance abuse, self-harm behaviors, suicidality, borderline personality disorder, and dissociative disorders. Because sexual abuse happens while a child is still developing, it can permanently alter the victim's sense of self, as well as his or her ability to trust others, making it difficult to form healthy relationships. Many adults who were sexually abused as children do not realize how it may have affected them. During the course of therapy, victims of child abuse often begin to see a link between their current problems and their past abuse. In remembering the abuse and mourning its damage, survivors can free themselves to lead more fulfilling lives.